Hello, this is Alan Jansen, a traditional acupuncturist with some 30 years experience. I'd like to take a little of your time and your effort to talk to you about traditional acupuncture and its efficacy in the treatment of what is known as chronic fatigue syndrome. Just this morning here in clinic, which is where we're recording the video, in my clinic here in Brisbane at the Gabba, Daniel came in. He was obviously a very successful businessman, judging by the latest model Mercedes that he did drive into the car park. I couldn't help but notice that. Very sleek vehicle, very nice gentleman, without doubt highly qualified, and also without doubt highly stressed in a senior management position in a large company. Daniel took ill with a severe dose of the flu last August. That's 6 months ago. He has never recovered, and he finds himself on a daily basis struggling with fatigue and exhaustion. He finds that he has migrating pain in his body that can move from his feet to his hands, to his neck, to his forehead, to his chest, shoulders, elbows. This migratory pain is a little bit like the phantom, here, there and everywhere. He's in a bit of trouble. I mean, he's just a young man. He's in his late 30s, very, very successful. And I did talk to him about how often chronic fatigue will assail an individual who is, if you like, a perfectionist to some degree. This is why many elite athletes end up with chronic fatigue syndrome, because they are particularly driven. And rest, R-E-S-T, is not a commonly used word in their vocabulary. And I think in the 21st century, much of this occurs where we're thinking 3 or 4 hours of sleep is enough, and we drive ourselves our 12, 14, 16, 17, 18-hour days, which is not uncommon if you like, at the top end of business, and certainly with the elite athlete and the degree and intensity of training that they undergo. And what can then happen is that athlete or the business person, they may pick up a virus, a flu virus, and instead of resting and taking it easy and allowing their body to recover and garner all of the forces from internal forces to form a blockade, if you like, to fight the viral infection, because that person maintains a higher level of activity, then the viral infection from a traditional acupuncture perspective can go deeper into the body, which makes it a lot more difficult to get rid of and leaves a legacy of aches, pains and overwhelming lethargy. In my experience, traditional acupuncture has been incredibly effective in working to assist this type of patient regain better health. I've worked with Olympic athletes and again highly stressed, very successful business people, and helping them to recover their health. And I'm pleased to say almost all occasions this has been the case. Traditional acupuncture, we address chronic fatigue in a unique way. We look at it obviously from an East Asian medical perspective if we are practicing traditional acupuncture. From this perspective, commonly chronic fatigue syndrome is what we would term as a spleen/pancreas deficiency syndrome. This means the transformation and transportation of nutrients and fluids in the body is compromised. So in part A, insufficient energy is being derived from the fuel that we take aboard, and part B, the ability of the body to transport the energy that has been manufactured to the extremities and the brain is impoverished as a result of the body's predisposition to deal with the presence of the virus deeper in the system. So when the virus does drive in deeply into the body system, according to traditional acupuncture physiology, this drains what we call the spleen or the earth energy, as it is the prominent organ meridian complex responsible for the immune system. And then this, as a knock-on effect, leads to the lethargy, leads to the fuzzy head and the unclear thinking, the indecisiveness, the general fatigue, the malaise, and the aches and pains in the body. So we call this a spleen/pancreas deficiency, and we work with tonifying and strengthening this earth or spleen aspect of the meridian organ systems in the body, whilst dealing with the areas where there's a relatively excess amount of energy. And this type of area will usually be somewhere where there's pain and discomfort. And that's our approach. It's very different to the Western medical approach, but clinically it has proven for me to be very effective. This is Alan Jansen, traditional acupuncturist of some 30 years clinical experience, saying thank you very much for joining us, and we'll catch you next time.